My name is Kairat Alikhan and my partner is Kharabay Sanjar. Research question is, why are teenagers more likely to have unhealthy children with diseases than more adults? In the videos shot on the TikTok platform, you can see pregnant minors. According to Noor.kz, the number of births in girls aged from 15 to 18 years old has increased by 50.5% over the past few years. By the end of 2022, 5.2 thousand such births were accepted in Kazakhstan. Adolescents have a higher risk of having children with diseases than adults. The probability of premature birth and the birth of low-weight children in adolescents is 15% and 30% higher respectively. The risk of congenital anomalies and perinatal mortality is from 10 to 15% higher. We have also provided several statistics in the form of graphs which contains information on fertility and abortion in different countries. There are also statistics on the birth rate among adolescents aged from 15 to 19 years old, the coefficient per 1,000 women, and the number of births taken in adolescents aged from 15 to 19 years old. The coefficient is 1,000. These problems are associated with several reasons. First one is teenagers often receive lower quality medical care during pregnancy, which can lead to inadequate screening and failure to take necessary measures to prevent complications. Second, teenagers are more prone to unhealthy behaviors such as smoking, alcohol consumption, and drug use, which can negatively impact fetal development. Third, teenagers' diets may be less balanced, which can also affect the health of the unborn child. Fourth, teenage pregnancy is often associated with high level of stress, which can impact fetal development and increase the risk of preterm birth. Finally, a teenager's body may not be fully prepared for carrying a baby, which can increase the risk of complications during pregnancy and childbirth. Children born to minors are at risk of developing sepsis, a serious condition caused by the body's response to infection, which can lead to systemic inflammation. This is especially true due to premature birth and low birth weight in such children. Symptoms include fever, breathing problems, and behavioral changes. Treatment requires immediate hospitalization and intense.
Now we know that sexual relationships in teenage years are dangerous because of all risks. But what can be the solutions for this problem? First solution is contraceptive pills. They help to prevent baby from being born by avoiding the risk of getting pregnant. According to Better Health VC, the pill works by stopping the ovaries from releasing an egg each month. It also thickens the fluid around the cervix, opening to the uterus or womb, to prevent the sperm from entering. By doing that, it prevents ovaries and sperm cells connecting and forming a baby, and so avoiding the risks of getting pregnant. The second solution would be to set standard lessons about sexual education, because most of unwanted sexual relationships in the teenage years happen because of lack of knowledge about it and its consequences. This would help to give more knowledge about this topic and prevent more people from having these relationships. According to Atwell Centre, sexual education is critically important for a variety of reasons, some of which are listed below. Sexual education helps teens understand their sexual and reproductive health and avoid negative health consequences such as STIs or unplanned pregnancy. So adding sexual education lessons to every school program would help to decrease cases of unwanted childbirth in teenage years significantly. Now let's talk about factors that they affect. These two solutions have a major impact on social factor. Major plus on social factor is that these solutions would prevent many lives of teenagers from being ruined by an accident, and many newborn babies having poor conditions and in some cases being even an orphans. But also social factor has a negative side, which is controversy and access. because access to contraceptive pills and proper sexual educations can be hard to acquire, and not many regions could have possibility to have them, and because of that many of the sexual teenage relationships take place. Also, because of this, sexual relationships between teenagers happen mostly in the poor countries when there is no access to these solutions. In conclusion, I wanted to say that understanding the teenage sexual relationships and their consequences would help to solve many other problems, such as many newborn babies being in orphans, many teenagers' life ruined, and etc. And also, we should understand that teenage sexual relationships are not normal, because in that age the body is not fully grown and it's not prepared to have a baby, and because of this many babies have diseases on a genetical level. So this was the whole video. Thank you for the attention. Leave a like, leave a comment below, and thank you, and see you soon.